Hi, in today's episode, we will be talking about cervical cancer. And to share with us more on that, we are glad to have with us here today Dr. Sharon Foo, consultant ONG from Thomson Specialists. So the first question is, what exactly is cervical cancer?
Okay, so cervical cancer is cancer of the neck of the womb or the narrow lower end of the uterus.
Okay, and how is it linked to STIs or what we call sexually transmitted infections?
That's a good question because cervical cancer itself is not sexually transmitted, but the majority of cervical cancers are caused by certain high strains HPV virus or human papilloma virus, and these viruses are sexually transmitted.
In that case then, is it true that only women with multiple sex partners or have a very active sex life that are at risk of getting cervical cancer?
So it is true that you're at higher risk if you do have multiple sexual partners, and particularly if you had early sexual debut, so before the age of 18 years old. However, up to 85% of women who are ever sexually active will carry the virus at some point in their lives.
Then how common is it in Singapore then?
So cervical cancer ranks 11th in terms of female cancer. So that doesn't sound very high, but it ranks 5th highest for cancer affecting young women, so between the age of 15 to 44 years old. And our stats from 2023, we actually had over 300 new cases and over 170 mortality or deaths from this condition. So it's a devastating condition for fairly young women.
That is definitely something that we want to pay attention to and to see what we can do about it. So Dr. Foo, what are the signs and symptoms that we have to look out for if there is cervical cancer?
So women might have abnormal vaginal bleeding, and that can present as unusual bleeding in between their periods or after sexual intercourse, or it might just be that their period is longer and heavier than usual. Also, there should not be any further bleeding after a woman has gone through menopause, so that would be something else to watch out for. Other common symptoms might also be pelvic pain during intercourse or after intercourse.
How regular should we be going for the screening in that case? And is there an ideal age or period that we should go for the screening?
So I encourage screening to start from 25 years old for women who are sexually active, and between the age of 25 to 29, you can choose to do just a Pap Smear and a negative test. Routine screening would be 3 yearly, and from 30-year-olds onwards, we can do the HPV DNA test, and a negative test. Routine screening will be every 5 years. Having said that, if you do screen positive or you have an abnormal test along the way, then the timing of repeating the test would vary, and your doctor will advise you accordingly.
So Dr. Foo, what should I do when I receive an abnormal test result?
Okay, firstly, do not panic. Okay, an abnormal test does not mean that you have cervical cancer. In fact, early cell changes can be completely treatable, and that's the whole idea of screening.
So does it mean that, Dr. Foo, if I get the vaccine, I am no longer at risk of getting cervical cancer?
Unfortunately, not entirely. So vaccination does not treat an existing infection, nor should it replace regular screening. Reason being, it only covers for 9 strains, so you could still carry other strains of the virus. And also, the virus can actually lie dormant in your body for over 10 years. So it's possible that it is missed during screening, because screening will only pick up an active infection. So it's important to still keep up with regular testing.
I also understand that there is an ideal age for getting the vaccine as well. So what is this ideal age period for getting the vaccine, and what happens if I missed it? Will it still be effective?
So ideally you want to get it when you're younger, when your body mounts a better immune response, and before you're sexually active, before you're exposed to HPV virus itself. So the earliest studies were for females aged between 9 to 26, but since then a lot more evidence has come up, and now the vaccine is encouraged not just for females but also for males all the way up to 45 years old. So if you've never been vaccinated, then I do strongly encourage.
Okay, so we should be getting our vaccine if you have yet to do so. What would your advice be to all of us ladies out there to ensure that we have good cervical health?
So firstly, make sure you get screened regularly. Secondly, to consider vaccination if you've not received the latest nanovalent one. And also practice safe sex. So for example, the use of condoms, and of course healthy lifestyle. So smoking cessation, regular exercise, healthy diet, all these makes a difference.
Okay, so that's great to know. In other words, we are all responsible and accountable for our own health. Go for regular screening, ensure that you have a healthy lifestyle, and may all of us always be in good health. Thank you so much, Dr. Foo, for your intensive sharing.